Welcome to Ironwood Cancer Insights, a podcast dedicated to exploring a myriad of topics surrounding cancer, from diagnosis to treatment and survivorship. Episode 8, Transgender Breast Health, with breast surgeon, Dr. Andrew Brown.
Hello and welcome back to Ironwood Cancer Insights. My name is Delaney Fama and I'm here with our breast surgeon, Dr. Andrew Brown. Thank you so much for joining us today. Today we're going to be going over breast health within the LGBTQIA plus community and how it affects them and how we can help navigate that.
Perfect,
thank you. To get started, let's talk about exactly what gender identity is and some of the key terms.
Sure, so understanding the basic concepts of gender identity and just basic terminology associated with the transgender population is very important to really cultivate a respectful and inclusive patient-provider relationship. So we'll start by just kind of defining some basic terms around gender identity, gender expression, and sexual orientation. So a cisgender individual is someone whose gender identity matches the sex that they were assigned at birth. Gender dysphoria is a situation in which one's gender identity doesn't necessarily match the sex that they were assigned at birth. I also think it's really important to note that not all transgender people experience gender dysphoria, and that it can vary in intensity from patient to patient. Non-binary is a term that is used for gender identities where an individual's gender identity does not necessarily conform to the traditional binary categories of male and female. Non-binary individuals can identify as a combination of genders, as neither exclusively male nor female, or even as a gender that is entirely separate from male and female. Gender fluidity is a term used to describe gender identity that can change over time or even in different circumstances. A gender fluid person may feel more masculine, more feminine, or even androgynous at different times, or they may feel a mix of all genders kind of simultaneously. And then transgender is an overarching term for people whose gender identity differs from the sex that they were assigned at birth. So a person that was assigned male at birth and identifies as a female, we consider that to be a trans woman, trans feminine, or male to female patient. And then on the other hand, a person who was assigned female at birth but identifies as male is considered either a trans man, trans masculine, or female to male.
What is the impact of the transgender population on the healthcare system?
Yes, so unfortunately this is a very data poor area with science and surgeries really developed over the course of like the last 20 years or so. Therefore, we don't have a lot of long-term data, so we really have to start with the basics to develop some more involved research while providing quality care to these patients in the here and now. As of 2023, there were approximately 1.3 million adults that identified as transgender, and this equates to about 0.5% of the national population.
What gender-affirming therapies are available for transgender individuals?
Yeah, so for transgender individuals, there are two major arms of gender-affirming therapy. One arm is hormonal therapy, and the other arm is surgical therapy. Of course, there are many other facets to gender-affirming care, including psychosocial therapies, but we won't get into that today. Regarding hormonal therapy for gender affirmation, so for transgender women on one hand, usually starts by taking medications like spironolactone. So this medication actually blocks all the androgen receptors to lower the amount of testosterone that is produced by the body. And then after they complete a round of spironolactone, they start estrogen-rich hormonal therapy. This is usually started 4 to 8 weeks after the initiation of that first medication. The estrogen-rich hormonal therapy really propagates the development of breasts on a cellular level, including maturation of the lobules, which make and store milk, and the ducts, which carry the milk from the lobules to the nipple for breastfeeding. It's important to note that these breasts are histologically the same as cisgender women, but they differ from cisgender males with gynecomastia. Breast buds really become apparent within that first 6 months of therapy, with maximal tissue development after about 2 to 3 years of the estrogen-rich hormone therapy. The estrogen-rich hormone therapy also has other effects on the body, not just the breast. That includes decreasing that masculine muscle mass, redistributing some body fat, decreasing libido, shrinking of the testicles, decreased sperm count, decreased body hair growth, and it actually causes the voice to become a little bit higher pitched. On the other hand, for transgender men, Their hormone therapy typically involves taking testosterone. This causes cessation of their menstrual periods and decreases the amount of estrogen that the ovaries are producing. And over time, this increases the body mass index, increases libido, causes the breasts to shrink, increases that male pattern hair growth, causes deepening of their voice, and causes clitoral enlargement and vaginal atrophy.
And what surgeries are available for transgender patients?
Yeah, so regarding gender-affirming surgeries, approximately 12,500 surgeries were done in 2020 alone. Of these surgeries, approximately 7,500 were top surgeries, and approximately 4,000 were genital or bottom surgeries. So let's start with trans women, so male to female patients. Generally, these patients undergo top surgery alone, which just involves breast augmentation. In this scenario, a plastic surgeon typically just places breast implants. On the other hand, for trans men or female to male patients, chest masculinization surgery or top surgery is done. I think the most important thing to point out regarding top surgery is that top surgery and oncologic mastectomy, or surgery that we do for breast cancer, they're not the same types of surgery. So a true oncologic mastectomy involves removing about 95 to 98% of that breast tissue, and typically leaves patients with a very flat or even concave chest appearance. This type of surgery typically isn't desired by transgender men due to the concavity of that chest wall. So instead, they typically aim to have a more masculine appearing chest. In contrast to oncologic mastectomy, top surgery typically leaves a portion of the breast tissue behind to create that more masculine appearing chest. The biggest concern that this raises is, what should we be doing for transgender patients to ensure that they're receiving adequate breast screening after they have top surgery? And then another question that it raises is, should some transgender men be undergoing true oncologic mastectomy instead of top surgery alone, given factors such as their family history or even their personal risk of breast cancer?
Wow, those are great insights. Thank you so much.
Yeah.
So with limited data on hormonal therapy and breast cancer risk, it is a very important thing that they do get their family history and everything checked. Is there, if there is a risk for family history of breast cancer, what options are available for the patients?
Yeah, so the best option we have is genetic testing. Here at Ironwood, we use the Invitae panel. So this is a 70 gene panel that actually screens for somatic genetic mutations. These panels tell us if patients are at an increased risk for lots of cancers, including breast cancer, ovarian cancer, pancreatic cancer, prostate cancer, and many others. So there are three basic outcomes for genetic testing. One is a negative result, meaning that the patient doesn't have a genetic mutation. A positive result, meaning that the patient does have a genetic mutation that we may act upon. And a third group called a variant of unspecified significance, or a VUS. A VUS just means that the patient's genetic makeup is slightly different from the overall population's genetic makeup. However, this change in genetics is not associated with an increased risk of cancer. And our genetic counselors really follow these VUSs and make sure that they haven't been upgraded. So given the results of the patient's genetic testing, we have the ability to refer them to genetic counselors who can formulate a full family pedigree and discuss personalized risks with the patients to help them make more informed decisions about their surgical planning. And I also think it's important to have a discussion with a breast surgeon to really discuss the oncologic mastectomy prior to proceeding with top surgery, especially if that patient has an increased family history of breast cancer. And we often pair with a plastic surgeon to reconstruct the chest wall and to provide that masculinized chest aesthetic.
So for example, if a patient had a positive genetic screening and they underwent top surgery, are there any recommendations for post-surgical breast cancer screenings?
Yeah, so there are actually many suggestions on post-surgical breast cancer screening in the transgender population. Organizations like UCSF Center for Excellence for Transgender Health, the Fenway Health Group, the Canadian Cancer Society, and the Susan G. Komen Foundation have all made recommendations regarding this topic, but they aren't very specific, and there's really no consensus among the groups. I believe that the best and most detailed recommendations come from the American College of Radiology. They released appropriateness guidelines in 2021 that really delineate each scenario and give recommendations on what should be used to screen these patients. The majority of my research and fellowship actually focused on provider knowledge base regarding breast health and transgender populations. We surveyed the medical staff at a major academic medical center and asked a few basic questions. So these questions were, do you care for transgender patients in your practice? Are you familiar with transgender breast screening guidelines? And how would you rate your overall comfort level with discussing breast cancer screening recommendations for the transgender population? And we found actually that the majority of providers surveyed do care for transgender patients in their practice. However, the majority also were unfamiliar with the current screening guidelines. And they were all interested in actually learning more about these guidelines to make them more comfortable having these discussions with patients. So I really think that where we should start is just educating ourselves about these recommendations. And really, I think the best and most specific guidelines are those American College of Radiology appropriateness guidelines.
Absolutely, so especially if it's going to help with screening and getting people more aware of cancer and everything.
Yeah, absolutely.
Are you aware of any future research projects relating to this topic?
Yeah, so while I think that provider knowledge base is very important, I also think it's really important that we understand where transgender individuals are getting personal information regarding their own breast health. I work very closely with a medical student at the transgender clinic at my fellowship program, and I know that they are at least working on one research project right now that will help answer that question. I think that by understanding these two aspects of both provider and patient knowledge, we'll be better able to answer questions and educate ourselves and our patients and community about the steps that we need to take to protect our breast health.
How can we make breast cancer care more inclusive for patients of all gender identities?
Yeah, so making breast cancer care more inclusive really starts with small but meaningful changes. Simple things like using inclusive language, displaying supportive symbols around the office, creating welcoming spaces for all patients. I think that one of the easiest things that we can do is just simply ask patients what pronouns they prefer.
Today we discussed improving provider education, expanding research, and ensuring proper screening guidelines for all crucial steps towards better care for transgender individuals. I want to thank you so much, Dr. Brown, for joining us today. We had a lot of good insights and we learned a lot of very important information. For additional resources, you can visit our website at www.ironwoodcrc.com. Thank you so much for joining us and watching. We'll see you next time. Take care.